Thank you, Tariq. Good morning, good afternoon, and good evening. On Monday, I ended our press conference by sending my best wishes to UNHCR, the UN Refugee Agency, for its 70th birthday. And today is International Migrants Day, and I'm delighted to be joined by Antonio Vitorino, Director General of the International Organization of Migration. Welcome, sir. IOM is our next-door neighbor here in Geneva and our very close partner. In recent years, we have witnessed the largest population movements and displacement since the end of the Second World War. Too often, migrants and their families remain outsiders in their adapted communities, even years after migrating. They face discrimination, social exclusion, and lack of access to health services. And yet, migrants make enormous contributions to our societies with new ideas that drive economic and social innovation. That's also true in the COVID-19 response. It was Turkish migrants to Germany who founded the company that developed the first COVID-19 vaccine to be approved and rolled out. And it was a nurse from the Philippines who administered the first dose of that vaccine in the UK. All around the world, many health workers are migrants, especially women, who account for 70% of the global health workforce. When the World Health Assembly designated 2020 as the International Year of the Nurse and the Midwife, none of us had any idea how much we would rely on nurses, midwives, and other health workers to keep us safe in the face of a global pandemic. We all owe a huge debt of gratitude to the nurses and midwives who are often the first and only health professionals present to treat and comfort the sick and dying and bring new life into the world. Together with Women in Global Health, the International Council of Nurses, the International Confederation of Midwives, the United Nations Population Fund, and Nursing Now, we yesterday launched a list of 100 outstanding women nurses and midwives from around the world who have made an exceptional contribution to nursing and midwifery. They represent millions of nurses and midwives who use their knowledge and expertise on a daily basis to protect the health and lives of others, at times putting themselves in harm's way to do so. To better understand the impacts of COVID-19 in refugee and migrant populations, WHO and the research consortium led by Ghent University and the University of Copenhagen has conducted a global survey called Apart Together. The survey was supported by several partners and included almost 30,000 migrants and refugees in almost all WHO member states. It shows that people living on the streets and in asylum centers are less likely to seek care if they have symptoms of COVID-19. Of those who reported not seeking health care, 35% said it was because of financial constraints, and a further 22% said it was fear of deportation. More than half of those surveyed said that COVID has caused them depression, worry, anxiety, and loneliness. These findings paint a bleak picture, but they also point the way forward. There are several measures countries can take to include refugees and migrants in response plans and public health measures. Access to care must not be linked to legal status. Improving internet access for migrants is also important for improving access to information. And most crucially, we call on all countries to remove financial and other barriers to care for migrants as part of their journey towards universal health coverage. Health for all means all, including migrants. That means increasing investments in health, especially in primary health care, to create health systems that are sensitive to migrants' needs, their language, and their health problems. These include reproductive and child health, mental health, trauma from injuries, violence, sexual abuse, and assault. Investing in the health of migrants is not just the right thing to do. It also has long-term benefits for social cohesion and economic development. Exclusion is costly in the long run, but inclusion pays off for everyone. It's also vital that migrants and refugees are included in plans for the rollout of vaccines against COVID-19. As you know, the ACT Accelerator, which includes the COVAX facility, was established to ensure access to vaccines for the world's poorest and most vulnerable people, many of whom are migrants. Earlier today, WHO and our COVAX partners, Gavi, CEPI, and UNICEF, announced that we have secured agreements to access 2 billion doses of several promising vaccine candidates. I would like to thank Canada and Prime Minister Trudeau for committing to share surplus doses of COVID-19 vaccines. These unprecedented agreements mean that all 190 countries and economies participating in COVAX will be able to access vaccines to protect vulnerable groups in their populations during the first half of next year. This week, I have spoken with CEOs of pharmaceutical companies and met with European Commission President Ursula and President Charles Michel in Brussels to ensure that we start vaccination as soon as possible in the new year. WHO and our COVAX partners are working non-stop to start vaccination as soon as possible in the new year. And WHO remains committed to working closely with IOM and many other partners to support countries in improving the health of migrants during the pandemic and after it's over. It's now my great pleasure to introduce Antonio Vitorino, Director General of the International Organization of Migration, to say a few words. Antonio? Fratello, mio fratello, you have the floor.
Thank you so much, Tedros. It's a great pleasure for me to be here today with you, not just as a neighbor, but as a close partner in International Migration Day. Because of all the reasons that you have just mentioned, it is indeed critical that we join forces to ensure that the most vulnerable, including, as you have said, migrants, refugees, asylum seekers, internally displaced persons, and in general people on the move, are not left out of our global efforts to fight back against COVID-19. I must say that contrary to the political rhetoric, most of these forcible displaced persons live in low and middle income countries, which tend to have weaker health systems and struggle to meet the health needs of their own population. Access to health, it's a human right. It's a human right of migrants too. But the list of barriers and difficulties that migrants face in accessing health care is far too long. That said, I believe that in some countries, being a regular migrant is a prerequisite to access to health care. But this leaves quite a large number of irregular migrants, stranded migrants, migrants that cannot return back home, and we estimate that we have 3 million stranded migrants all over the world, and leaves also migrants in detention uncovered. Too often, health information is not given in a language that is understood by migrants. And last but not least, as you have mentioned, migrants are particularly prone to anxiety, to insecurity, to mental health and psychosocial problems, and especially women and girls who are particularly vulnerable. And to be honest, what I have found particularly intolerable in this current crisis is that while being so often left behind, migrants have also been on the front line of the response to the pandemic, taking personal risks for everyone's well-being, and these across many critical sectors, not just the healthcare sector, but also transport, food, retail, research, hygiene, and home care, you name it. So I'm happy to be able to tell you that many countries have understood the importance of universal health coverage. Already before the pandemic, about 43% of all countries offered health coverage to all migrants, no matter their legal status. And in this year of public health emergency, several host countries have temporarily introduced new policies or relaxed requirements to grant access of migrants to health care. But this is not enough. One of the crucial issues is that migrants sometimes are suspicious to look for health care because they are afraid that contacting health services, they might be detained or even deported. Building a mutual trust relationship between public health services and migrants will be crucial, especially now, as we are going to have a true test case. As we collectively gear up for one of the world's largest vaccination campaigns, I believe that we must be vigilant and ensure that access to the vaccine is fair and equitable. I praise the efforts of WHO in the COVAX environment and the WHO partners, Gavi and the Vaccine Alliance on this front. And therefore I want to take this opportunity to call on governments to count and include all migrants present in their territory, no matter their legal status, in their national vaccination plans. And let me be very clear. As governments prioritize health workers on the front lines, they need to make sure that migrant frontline health workers are also vaccinated. And as governments prioritize people above a certain age, then all migrants about that same age should be prioritized in the same way. It's not a question of creating any preference or privilege to migrants, it's to guaranteeing access to the vaccination on equal foot as the nationals. It remains vital that migrants in vulnerable situations have access to immunization and essential primary health care services, including mental health, in humanitarian settings as much as in urban slums or border communities. From our side, Tedros, you can count on IOM engagement and support for the efforts to guarantee a successful vaccination process that we finally defeat the virus. Thank you.
Thank you, thank you so much, Antonio. So, Tariq, back to you.
Thank you very much, Mr. Vittori.